Have you ever woken up in the middle of the night with swollen legs or rushing to the bathroom again and again and just told yourself it's probably nothing? What if I told you those little annoyances could actually be the first silent cries of your kidneys? Failing, I'm not exaggerating, up to 90% of people with kidney disease don't even know they have it until it's too late. And by then, the damage is permanent. That's why doctors call it the silent killer, because it creeps into your life without pain, without warning, until suddenly it steals your health, your independence, and in many cases, your life. But here's the good news. If you can recognize the warning signs early, you can stop this process before it destroys everything you've worked for. I'm Dr. Johnny, and in today's video, I'm going to walk you through the 17 most critical red flags of kidney disease. Some of them may seem harmless, like changes in your nails, or how often you wake up at night, but together they can mean the difference between catching kidney damage early and facing dialysis for the rest of your life. So listen closely, because what you're about to learn could save you or someone you love. And it all begins with one of the strangest but most important signals, something you might have seen in your own bathroom without realizing what it truly means. Let's start with one of the strangest yet most overlooked red flags: foamy urine. I'm not talking about a few bubbles that disappear in seconds. I mean a thick, frothy layer that lingers on top of the toilet water, almost like the head of a beer. I once had a patient who came in embarrassed, whispering, "Doc, my urine looks bubbly. Is that normal?" He thought it was nothing. But when we tested him, we discovered proteins spilling into his urine. Clear evidence his kidney filters were breaking down. Here's the science. Your kidneys contain about 1 million microscopic filters called glomeruli. Their job is to hold on to vital proteins like albumin, not let them escape. But when those delicate filters are damaged, albumin leaks through, and because albumin foams up like soap, it creates that frothy layer you see. Studies show that people who ignore this warning sign are up to 40% more likely to progress to advanced kidney disease. So if you ever notice urine that stays foamy, don't laugh it off. It could be your body waving a red flag. But just recognizing this first whisper of kidney trouble isn't enough, because the next warning doesn't show up in your urine at all. It shows up in your legs, and it may be even more dangerous. If foamy urine is the first whisper of kidney damage, then swelling in your legs, ankles, or even around your eyes is the body's louder cry for help. I'll never forget a woman in her early 50s who told me her shoes felt tighter every evening, even though her weight hadn't changed. She thought it was just fatigue or standing too long at work, but when I pressed gently on her shin, a deep indentation remained. That's called pitting edema, and it's one of the clearest outward signs that your kidneys are struggling. Here's why. When your kidneys leak protein, like albumin, into the urine, the protein level in your blood drops. Without enough albumin to hold fluid inside your blood vessels, water seeps out into your tissues. Gravity pulls it downward, so you see swelling in your legs and feet first, or puffiness under your eyes in the morning. And here's the dangerous twist. Even though your body looks swollen, your blood vessels are actually low on fluid. Your kidneys get tricked into thinking you're dehydrated, so they hold on to even more salt and water, creating a vicious cycle of swelling that only gets worse. Studies show that nearly 60% of people with chronic kidney disease experience edema before they're ever diagnosed. So if your shoes feel tighter at night or you notice swelling that doesn't fade, don't dismiss it as aging. It may be your kidneys crying out for attention. But only spotting swelling won't save you, because the next warning sign doesn't attack your appearance. It invades your sleep, and that makes it even more alarming. If swelling in your legs is the loud warning cry, then waking up multiple times at night to pee is the alarm that never lets you rest. I once had a patient who joked that he could count every tile on his bathroom floor because he was up 3 or 4 times every night. At first, he thought it was just age or drinking too much tea before bed, but the truth was far more serious. His kidneys had lost their ability to concentrate urine. Here's the science. Normally at night, your kidneys slow down and make a small concentrated amount of urine so you can sleep peacefully. A hormone called ADH controls this process, but when the kidney filters are damaged, they can't hold water effectively. Instead of making concentrated urine, they produce large volumes of diluted urine, forcing you awake again and again. Research shows this condition, called nocturia, often appears in the earliest stages of kidney disease, long before other symptoms show up. So if you're constantly running to the bathroom at night, don't just blame it on getting older. It could be your kidneys sending an urgent message that something is wrong, but only paying attention to your sleep isn't enough because the next clue doesn't show up at night. It can be seen right at your fingertips in a way most people would never expect. While nighttime bathroom trips reveal what's happening inside your kidneys, sometimes the warning signs show up on the outside right at your fingertips. Most of us only glance at our nails when trimming them or putting on polish, but for one man in his 60s, his nails were quietly screaming for help. The top half of his nails had turned a reddish brown, while the bottom half remained pale. He shrugged it off for years, assuming it was just aging, but in reality, these were half-and-half nails, a striking indicator of chronic kidney disease. Here's the science. Normally, the base of your nail appears lighter because it's still under construction, a natural growth phase. But when kidneys are damaged, the balance of proteins and hemoglobin in your blood shifts. This chemical change causes the lower half of the nail to stay pale, while the upper half darkens into a brownish red. Research estimates that up to 40% of patients with advanced kidney disease develop this condition, yet many ignore it, thinking it's just cosmetic. So if you ever notice your nail splitting into two colors like this, don't dismiss it. It could be your body's way of flagging kidney trouble before it's too late. But spotting unusual nails is still just scratching the surface because the next hidden danger doesn't stay on your fingertips, it hides deeper in your blood chemistry and can even harden your skin from the inside out. If your nails are like tiny health reports you carry every day, then the next sign is like a hidden time bomb sitting under your skin. I once treated a man who noticed hard, whitish-yellow bumps forming on his arms. They didn't hurt, they didn't itch, so he ignored them for years, thinking they were harmless. But those bumps weren't skin problems at all. They were calcium phosphate deposits. A direct consequence of HRAWA is failing kidneys. Here's the science. Healthy kidneys flush out excess phosphate from the food you eat. But when your kidneys start to falter, phosphate builds up in your bloodstream. It doesn't stay quiet, it binds with calcium, creating crystals that can lodge in your skin, forming those hard bumps doctors call calcinosis cutis. Sometimes they even break open, leaking a chalky white substance that looks disturbingly like toothpaste. The real danger, though, is when these crystals settle inside your blood vessels, a condition called calciphylaxis. That's when arteries harden like bone, cutting off blood flow to vital organs and tissues. In severe cases, it can be fatal. Studies confirm that elevated phosphate levels dramatically increase the risk of heart disease, amputations, and sudden death in kidney patients. So if you notice unusual bumps under your skin, don't dismiss them as cosmetic. They might be your kidneys crying for help from the inside out. But phosphate problems don't just scar your skin or harden your arteries. They can also rob your muscles of strength, triggering painful cramps that often strike in the dead of night. If phosphate crystals can harden your arteries, the damage doesn't stop there. They can also drain the strength right out of your muscles. One of my patients, a retired teacher, told me her nights had turned into torture. Just as she was about to fall asleep, her calves would seize up the pain so sharp it shot her awake. She thought she wasn't drinking enough water, but the truth was much deeper. It was her kidneys. Here's the science. Your kidneys don't just filter waste. They also keep a delicate balance of minerals like calcium, magnesium, and potassium. When kidney function declines, these minerals swing wildly out of range. Low calcium, low magnesium, or even too much acid in the blood can all trigger those sudden, excruciating cramps. Research shows that more than half of kidney disease patients suffer from frequent nighttime muscle cramps, often when the body should be resting and repairing. And the danger isn't just the pain, it's what those cramps are signaling, that the chemical balance in your blood is dangerously unstable. So if you find yourself jolted awake by muscle cramps again and again, don't just brush it off as dehydration or aging. It could be your kidneys sounding the alarm. But cramps are only the beginning, because when mineral imbalances persist, they don't just attack your muscles, they quietly erode the very foundation of your skeleton. And when cramps keep stealing your sleep, the next strike of kidney disease can be even more devastating. It silently weakens your bones. I once spoke with a woman who swore she hadn't fallen or injured herself yet. One morning, she woke up with unbearable back pain. An X-ray revealed tiny fractures in her spine. What shocked her wasn't the fracture itself, it was learning that her kidneys had been quietly stripping minerals from her bones for years. Here's the science. Your body needs calcium in the blood to function properly. But when the kidneys fail, They can't activate vitamin D into its usable form, so your intestines absorb far less calcium from food. At the same time, phosphate builds up in the blood, which further pulls calcium out of circulation. To fix this shortage, your body releases parathyroid hormone, which literally breaks down bone tissue to free calcium into the bloodstream. The cost, your skeleton becomes brittle thin and prone to fractures. Research shows kidney patients are several times more likely to suffer hip, wrist, or spinal fractures, and many even notice their height shrinking over time. So if you've lost height or if a simple bump leaves you with a broken bone, don't just chalk it up to aging. It may be your kidneys, weakening your foundation from the inside out. But brittle bones aren't the only painful sign, because the very same toxins that strip your skeleton can also creep into your skin, leaving you with an itch so relentless it robs you of peace day and night. Just as fragile bones can steal your strength, kidney toxins can also torment your skin, leaving you with an itch so relentless it feels like torture. I'll never forget a 57-year-old man who came into my clinic with deep scratch marks all over his arms and chest. He told me, "Doc, I can't sleep. I itch so badly I feel like I'm losing my mind." There was no rash, no allergy. What he was experiencing was the hidden effect of failing kidneys. Here's the science. When your kidneys can't clear waste, toxins build up in your bloodstream. Some seep into the skin, directly irritating nerve endings. Others activate special itch receptors, making your skin hypersensitive to even the lightest touch. And it doesn't stop there. Those same toxins can travel to your brain, flipping on the itch circuits so that you feel itchy even when nothing is touching you. Research shows nearly half of kidney patients suffer from this condition, often worse at night, robbing them of sleep and peace of mind. Imagine the misery of poison ivy, but every day with no relief. So if you find yourself constantly scratching without explanation, it could be your kidneys sounding the alarm. But itching is only one way kidney disease hijacks your nerves, because the very same imbalance can crawl deeper into your legs, sparking a restless crawling sensation that makes it impossible to stay still at night. And if itchy skin robs you of rest, the next warning sign can drive you absolutely mad at night. Restless legs. One of my patients, a 62-year-old grandfather, told me he dreaded bedtime. The moment he lay still, his legs felt like they were crawling, buzzing, almost electric. He couldn't resist the urge to move, and the constant kicking left both him and his wife exhausted. He thought it was poor circulation, but the truth pointed back to his kidneys. Here's the science. When kidney function declines, toxins build up and trigger inflammation. That inflammation raises levels of a hormone called hepcidin. Normally, hepcidin is released during infections to keep iron away from bacteria. But in kidney disease, it stays high even when there's no infection, trapping iron in storage and leaving your brain short of what it needs. Without enough iron, your brain can't make dopamine properly, and dopamine is the key chemical that keeps your muscles calm. The result, that irresistible crawling urge to move your legs. Studies show restless leg syndrome affects up to 40% of people with chronic kidney disease, destroying sleep and draining energy during the day. So if your nights are filled with endless twitching and tossing, don't assume it's just nerves. It could be your kidneys hijacking your rest. But restless legs are only part of the story, because the same toxins that hijack your nerves can also creep into your mouth, twisting your sense of taste, and even making your breath smell disturbingly like urine. And while restless legs keep you awake at night, the next sign follows you into the day, stealing the joy from something as simple as eating. Imagine biting into your favorite meal, maybe a juicy burger or a slice of apple pie, and instead of tasting delicious, it tastes like metal. One of my patients told me, "Doc, it's like licking a handful of pennies every time I eat." His wife added that his breath had started to smell faintly of urine. These weren't just embarrassing quirks, they were clear signs of kidney failure. Here's the science. When your kidneys can't clear urea from the blood, it seeps into your saliva. The bacteria in your mouth break it down into ammonia and other byproducts, creating that metallic taste on your tongue and the sour urine-like odor on your breath. Doctors call this uremic fever. Research shows up to 70% of patients with advanced kidney disease report changes in taste, and many completely lose their appetite as food no longer tastes appealing. Over time, this leads to dangerous malnutrition, which only accelerates kidney decline. So if your meals suddenly taste metallic or your breath carries a strange odor, Don't ignore it. It could be your kidneys waving a desperate red flag. But the danger doesn't stop at your mouth, because the very same toxins that spoil your taste can climb higher into your brain, triggering relentless nausea, vomiting, and a complete loss of appetite. And if a metallic taste and strange breath weren't unsettling enough, kidney toxins can take it a step further by hijacking your brain and shutting down your appetite completely. I remember a patient who came to me after losing nearly 20 pounds in just a few months. He said, "Doc, I don't even want to eat anymore. The thought of food makes me sick." He wasn't dieting. He wasn't exercising more. His kidneys were slowly starving him. Here's the science. As waste products like urea and other toxins build up in the blood, they reach a part of the brain called the chemoreceptor trigger zone. Unlike most areas of the brain, this zone isn't protected by the blood-brain barrier because it's designed to detect poisons quickly. Normally, it saves your life by triggering vomiting when you eat something toxic. But in kidney disease, the constant overload of toxins fools your body into thinking it needs to vomit, leading to persistent nausea, repeated vomiting, and a complete loss of appetite. Research shows that malnutrition affects nearly 40% of people with advanced kidney disease, and once severe weight loss sets in, recovery becomes much harder. So if you've been losing weight without trying, or if food you once loved now makes you feel sick, don't ignore it. It could be your kidneys begging for attention. But nausea and weight loss aren't the only dangers, because kidney disease can also interfere with something even more vital: your body's ability to stop bleeding. And when kidney toxins steal your appetite, they often steal something far more dangerous: your body's ability to stop bleeding. I once had a woman come into my clinic covered in deep purple bruises on her arms and legs. She couldn't even remember bumping into anything. Another patient, a middle-aged man, told me his gums bled every time he brushed his teeth, and his nose would start bleeding for no reason. These weren't random accidents. They were his kidneys warning him that his blood could no longer clot properly. Here's the science. Normally, tiny cells in your blood called platelets act like natural band-aids. They rush to plug a cut or injury and stick together to stop bleeding. But in kidney disease, toxins coat the surface of these platelets, making them slippery and less sticky. As a result, clots can't form as strongly as they should. That's why bruises appear from the lightest bump, and even small cuts can bleed far longer than expected. Studies show that platelet dysfunction is one of the most common complications of advanced kidney disease, leaving patients vulnerable to uncontrolled bleeding. So if you notice unexplained bruises, bleeding gums, or frequent nosebleeds, don't brush them off. It could be your kidneys struggling in silence. But bleeding isn't the only strange thing kidneys can do to your skin, because when waste levels rise to extremes, your sweat itself can leave behind a chilling, powdery residue. And if unexplained bruising and bleeding weren't unsettling enough, the next sign is something you can actually see and feel on your skin, a chilling condition doctors call uremic frost. I once treated a man in his late 30s who had missed several dialysis sessions. When he walked into my office, his skin looked as though it had been dusted with fine white powder. At first glance, it resembled flour or dandruff, but it wasn't either. It was crystallized urea waste his kidneys could no longer remove, pushed out through his sweat and left behind on his skin. Here's the science. In end-stage kidney failure, toxins in the blood skyrocket. With nowhere else to go, some of those toxins exit through sweat glands. As the sweat evaporates, it leaves behind a residue of urea crystals across the skin surface. Doctors call this uremic frost. It's rare today thanks to dialysis, but when it appears, it's a sign of dangerously high toxin levels that can threaten life in days, not years. Patients who present with uremic frost are often in critical condition, and without immediate treatment, the outcome can be fatal. So if you ever see a strange powdery coating on your skin, or someone else's, don't assume it's dryness or dandruff. It's a medical emergency. But even frost on your skin isn't the worst of it, because kidney toxins don't just escape through sweat. They can also inflame the very sac around your heart, turning every heartbeat into a painful grind. And if uremic frost is a chilling reminder of how toxins can escape through your skin, the next warning sign is far more dangerous. It strikes at your heart itself. I once cared for a man whose chest pain wasn't the sharp, crushing kind of a heart attack. Instead, it was constant, heavy, and unbearable, like sandpaper rubbing inside his chest with every beat. What he had wasn't a blockage, it was pericarditis, an inflammation of the thin sac surrounding the heart caused by kidney toxins. Here's the science. When waste builds up in the bloodstream, it irritates the pericardium, the protective lining around your heart. Unlike a sore knee or aching back, you can't rest your heart. It keeps beating nonstop, and with every movement, it scrapes against the inflamed tissue. Doctors can even hear a scratchy grating sound called a pericardial rub when listening with a stethoscope. If untreated, the condition can escalate to pericardial effusion, where fluid builds up around the heart, compressing it so severely that it can no longer pump blood properly, a life-threatening emergency. So chest pain and kidney disease isn't always about clogged arteries. Sometimes it's your own toxins attacking the heart's shield. But even before things get this severe, kidney disease has another way of draining your life. It doesn't attack with pain, but with a crushing fatigue that makes everyday tasks feel impossible. And while chest pain from pericarditis is dramatic, kidney disease often robs you in a quieter but relentless way. It drains every ounce of your energy. I remember a woman who told me, "Doctor, I feel like I'm walking through quicksand. Climbing one flight of stairs feels like running a marathon." She wasn't lazy, and she wasn't just getting older. Her kidneys were no longer producing enough of a critical hormone called erythropoietin, or EPO. Here's the science. EPO is like your body's natural signal to the bone marrow, telling it to make red blood cells. Those cells carry oxygen to your muscles, your brain, and every organ in your body. Without enough EPO, your blood becomes anemic, meaning you don't have enough red blood cells to deliver oxygen where it's needed. The result is extreme fatigue, breathlessness, weakness, and a crushing exhaustion that no amount of sleep can fix. Studies show that anemia is one of the most common complications of chronic kidney disease, affecting nearly 90% of patients in advanced stages. So if you feel exhausted all the time, even after resting, don't dismiss it as just age. It could be your kidneys silently shutting down your oxygen supply. But here's the most frightening part. Sometimes kidney disease doesn't cause fatigue or pain or any warning at all until it's already dangerously advanced. And as crushing as fatigue can be, the most dangerous sign of all is no sign at all. I've seen countless patients who came in for something routine, maybe a diabetes checkup or a blood pressure test, only to discover their kidneys were already in stage 3 failure. They felt fine. No swelling, no pain, no warning. By the time symptoms finally appeared, nearly half of their kidney function was already gone. Here's the science. Your kidneys are masters of compensation. You're born with about 1 million microscopic filters in each one. As damage begins, the remaining filters simply work harder, picking up the slack. That's why kidney disease can advance silently with no obvious clues until it's dangerously late. Studies show that nearly 9 out of 10 people with chronic kidney disease don't know they have it until it's already advanced. That's why it's called the silent killer. So if you have risk factors like high blood pressure, diabetes, or long-term painkiller use, don't wait for warning signs. Get tested with simple blood and urine checks. Because once silence is broken, the battle is already harder to fight. And speaking of risk factors, let's uncover the 3 biggest culprits that quietly push the kidneys toward failure every single day. And if silence is the most frightening symptom, then the final truth is even more sobering. The real killers of kidney health are often conditions and habits we see every single day. The top 2: diabetes and high blood pressure. I've had patients who carefully watched their weight, exercised, even avoided junk food, but neglected their blood sugar or their blood pressure, and their kidneys paid the ultimate price. High blood sugar slowly scars the kidney filters, while high blood pressure relentlessly pounds them, wearing them down until they fail. Together, these two account for nearly 3 out of every 4 cases of chronic kidney disease in the United States. But there's a third danger. Most people never think twice about painkillers. Over-the-counter NSAIDs like ibuprofen and naproxen may seem harmless when you grab them off the pharmacy shelf, but taken daily or long-term, they can choke off blood flow to your kidneys. I've seen patients who thought they were being responsible treating headaches or arthritis, not realizing those little pills were slowly cutting off their kidney's lifeline. So if you truly want to protect your kidneys, controlling blood sugar and blood pressure is non-negotiable, and painkillers should never be a daily habit without your doctor's guidance. Because while the warning signs tell you what's happening now, these root causes decide your future. And that's why the conclusion to all of this isn't just about fear, it's about hope and the steps you can start taking today to protect your kidneys for life. So if you've recognized even one of these warning signs, don't panic. Remember, knowledge is power. The fact that you're here listening and learning already puts you one step ahead in protecting your kidneys. Take care of your blood pressure, keep your blood sugar under control, and always think twice before reaching for painkillers. Small, consistent actions can make a huge difference. If this video has helped you, make sure to save it so you can revisit these signs anytime. And don't forget to subscribe to the channel so you'll always get the latest medical insights to protect your kidneys and your overall health. Your kidneys work for you every second of every day, silently keeping you alive. Now it's your turn to protect them. With the right steps, you can live longer, feel stronger, and enjoy the life you deserve. Stay curious, stay healthy, and I'll see you in the next video.